Hi, I'm Sue Waltermeyer, and I'm a certified child life specialist at Care for the Kids. I'm really fortunate to be able to be at Care for the Kids as a child life specialist because I've worked in a lot of places, and child life can look a little bit different depending on where you work and what kind of support you have from the organization and your fellow team members, especially those who are not child life specialists, because we really depend on the medical team to utilize us appropriately. Here at Care for the Kids, we really I think take an extra step to make sure that our patients have as positive an experience here with our clinic as possible. And that means helping them understand what's going to be happening while they're here and how we can help them cope with things that might be difficult for them. When we have a newly diagnosed patient, it's always important for me to be part of that first face that they see to help explain why they're here and kind of review what's happened before they've gotten here. Why are they here? Do they understand what the reasons are? And maybe rewind and look at some of the symptoms they may have presented with that took them to other medical facilities for tests and things that ultimately left them here to Care for the Kids. And also to kind of get a history of what those medical experiences were, because if a child has had a medical experience somewhere else, that predisposes them to being worried or afraid about a similar medical experience happening here. And so being aware of that can help us maybe mitigate some of the negative experience they've had in the past, or know where to start with helping them cope with the experiences they'll have here at our clinic. One of the things that we always want to make sure our children have is as little discomfort as possible. So what are the things that we can do as a team to make this experience for them as comfortable as possible? There are some things that we can't change, but by the words we use or the way we approach it, we can help it be a less scary experience for the child. So words that we use to help kids understand is giving them appropriate sensory information. Instead of telling a child, well, this is going to burn when it goes in, or this is going to sting, we can say, this might feel really warm. You can tell me how it feels for you. That's opening it up for the child to have a different sensory experience than maybe we might make them anticipate by cueing them. We want to avoid, when our children are getting chemotherapy, hanging a bag and saying, oh, this is the one that makes you throw up, because we have a lot of kids who even before the chemotherapy is presented are experiencing nausea and vomiting in anticipation of that. And once the chemo has stopped running and the bag is gone, they're fine, yet they still have chemo in their body. So there's a really connected brain-body response to treatment sometimes, and so being aware of those sorts of things and understanding what children of different ages understand about what's happening to them and why it's happening to them and how they can cope or can't cope. With little kids, it's distraction. Toddlers tolerate pain better than they tolerate separation from their parents, so how can we keep that parent close by when something might be painful or unpleasant? We also try really hard to make sure that our kids have coping techniques to help them and compliment them when they're using that. We teach our kids magic breaths. We smell the flowers and blow bubbles through a straw. Because when kids are upset and scared, sometimes they hold their breath. And the body's response to not getting oxygen is to feel a little panicky, which heightens that anxiety. So if we can be doing deep breaths and getting good oxygen, that helps keep the body a little bit quieter and calmer. Our nurses are terrific at incorporating a lot of these techniques into their nursing. And I worked in places where that wasn't always the case, where the child life specialist was the play lady, and we were called for things like video games or toys, but never called for things like preparing a child for a procedure or supporting them through something difficult. So I'm really fortunate here at Care for the Kids to be part of such a comprehensive team that really looks at the whole child and what their needs are in the moment, and nurses who are so patient and willing to wait an extra hour or so to make sure that the procedure or process that we're going through with the patient is as positive as possible. Thanks for joining me.